Hi, I'm Patricia Greenberg, and this is It's Okay to Be Old, a show about all things aging well. Well, did you know that February is National Dental Pet Month? And so I've decided to have on a veterinarian today. Are you an animal lover, or do you view pets as a nuisance? Are you afraid to take on the responsibility of a pet at an older age? My guest today is renowned Los Angeles veterinarian, Dr. Kevin Schlanger. He's the owner of Brent Air Animal Hospital in Culver City, California. And we're going to talk about all things aging and pets. Now, this is kind of a two-part. One is, of course, we're going to talk about how having a pet actually helps us age well and also caring for an aging pet. Welcome, Dr. Schlanger.
Thank you very much. Appreciate it. Happy to
So
be here.
delighted to have you here. Um, Dr. Schlanger's been taking care of my dogs for 20 years, and we'll talk about that as we go because we've got a lot of fun stories about that. But I want to tell us a little bit about how you became a veterinarian.
It's an interesting story. It's not the typical one because it was a second career for me. I was an engineer by training and by trade for a while. Was always interested in medicine and animals and different species, etc. And was kind of refocusing back towards medicine. And for me, it was more an appeal to treat multiple species. That was kind of the trigger for me, and just the difficulty and complexity of being able to treat animals was something that really had a lure for me and was interesting to me. So I went back to school, and here I am, 20, however many years later.
Yeah. I know we lose count, right? As you reach a
Yeah,
certain age, you're like,
yes,
I
we
don't know,
do.
remember how long I've been doing this. Yeah. And we know now that one of the, key elements of healthy aging is and social connection is having pets. Like, not only
Absolutely.
is it just do we play well with other humans, how do we do with animals? They really play a huge role in the health span of our lives as well. Having a cat, a dog, even a horse, a goat, a cow, and I'm really not being funny. I mean, just how we can fall in love with pets and make them a part of their family. It doesn't, it's not just confined to dogs. And it's really in the same way of having friends and family around. But I really want to talk to you about animal behaviors versus humans. You spend your day taking care of animals, and since they can't speak, what have you observed about how they communicate what they need?
It's an excellent question. And yes, not speaking makes our job much more difficult. We have to rely on a lot of basic skills, a lot of interpretation, a lot of understanding, etc. But they are communicating. It's just not speaking. That's the big difference. So, they communicate, they show pain, there are signs. The dogs will vocalize, tail wagging. There's responses to when they're uncomfortable, ears being back. There's facial expressions, obviously limping. For example, we get, I get questions all the time. Well, my dog is limping, but they're not in pain. And we try to explain to clients, well, by definition, if
Yeah.
they're holding a leg up, something's causing them to hold the leg up. And usually that's a sign of pain. It may not be overt pain or significant pain. And, obviously we don't ask them to grade it out of 1 to 10 or things like that we can do. But you definitely, there is a level of communication. It's just much more limited, and you have to use a lot of insight to try and figure out what they're trying to tell you.
Kevin, I know that this is an insurmountable nut that vets have to crack is to get people to train their animals properly. I mean, it, I'm the biggest loser dog parent because I don't put my foot down. I let the dog in the bed. I do all kinds of things I'm not supposed
Yeah,
to do, and I know that. But I
me
just,
too, by the way, if it
yeah,
makes you feel better.
yeah. And so, just like, what are some simple top five, if you will, the ways we can integrate a dog or a cat into the house with minimum stress?
It's really a understanding their breed, their natural inclination, understanding how they are trying to communicate, understand what is appropriate for them, those kinds of things. So, when you bring a new either dog, cat, or as you said, any other animal into your house, you have to use some understanding of the situation, meaning if they seem like they're responding to some things, if they're food motivated, you can use that to your advantage to try and get them to respond to basic commands. If they are comfortable in a certain environment versus a different environment, trying to make sure the environment matches what it is that they're comfortable with. And a lot of it is just understanding, looking for signs, knowing when they're responding positively versus negatively to something, and focusing mainly on the positive response versus the negative. One of the things that we emphasize most is that you know dogs, cats especially, will respond better to positive reinforcement more so than negative reinforcement. So when they do a behavior that you're trying to reinforce, a lot of reward, a lot of positive, a lot of praise, things like that, they don't really focus or understand as well when they've done something wrong what the negative aspect is. They understand the re you know emphasis on the positive part.
So the other, again, this is like I think a whole nother afternoon and a whole nother show is talking about household appropriate breeds, right? That we have
Yes,
to think about what fits the family, and that's a
absolutely.
bottomless pit of
Yeah,
conversation, I'm sure.
right, right.
Um, I want to
Cute
share
is
with
not
you.
always the answer. That's the
Yes,
bottom
exactly.
line.
Yes. We have different needs. So I just want to carry this over because I think this really feeds into how we can talk about it helps older adults. When my daughter was little, we had, I don't even know what the dog was. It looked like an alien, an Ewok. You remember Gingerbread Man?
Yep.
And he was a mix of some sort of terrier.
Pizza, Lawsuit Terrier or
So yeah, it
whatever,
was
something like
crazy, crazy
that.
mix. Adorable dog. Everybody
Right.
loved him. We didn't even have to train him. He just did what he was told from the day we got him. He was a good dog. He barely peed in the house. He was amazing. And then we went the other direction, and somebody dropped a Saint Bernard on my front porch, knowing I love the breed. We went on to get a second Saint Bernard. Dr. Schlanger had to come to my house a few times. Bringing those dogs in required a U-Haul. The girl was 140 and the boy was 180. They were the most lovable dogs in the world. We had a little trouble with the boy wanting to be a guard dog, but my point was we had an 8 pound who eventually grew to about 14 pounds. And then we had gigantic, it was like having cows roaming around in the house. But it fit into my family. Now I have a yellow lab who's a very spunky, wonderful dog, but also she doesn't give us any trouble. In
Right.
fact, someone comes to the house, she lays on the porch, lets them step right over her and come in the house. So it's interesting to me. But Kevin, I would like to really focus on what breeds, if you can narrow it down, are helpful for older adults? Because I would not, at our ages, we're in our 60s and 70s, take a St. Bernard into the house or take that size animal. What do you recommend for someone who is an older adult, possibly living alone, but needs the safety, the companionship, and also I guess even if they're not a special support dog, what
Right.
really works for an older adult? A puppy, an older dog? What are the guidelines for that?
They're excellent questions, and
Uh-huh.
I mean, certainly, there's a lot of work that goes into a puppy, no question. Training, a lot more visits in the beginning, and vaccines, and
Sure.
they're growing, and there's a lot of work, and they have a lot of energy. I never think that that's the best idea unless it's a unique situation where the dog is very relaxed or docile or whatever. But usually puppies are best avoided if you're older, or even if you're infirmed or have issues. It's going to be a lot of work, and it's better avoided if possible. Um, that being said, we do have a lot of older patients who get older dogs because they feel like that's, an easier route to go. But on the other end of the spectrum, there's a lot more medical issues that you may be dealing with, and orthopedic issues that make it more difficult. And obviously lifting and carrying and all of that makes it more difficult. So, usually we recommend that people, when they're older and are looking for a companion, look in that middle range. A dog that's already not a puppy, but 2 to 5, let's
Uh-huh.
say, or three
Uh-huh.
to six, or somewhere in that range, which is much more convenient, and less issues, and easier to deal with. In terms of size, I agree with you. I mean, there's no question that although I mean I have a bull mastiff currently, which is a big
Oh,
dog. So she's on the smaller side. She's 75 pounds, but you know, I can barely walk her without her
yeah,
pulling me down the street, and just because she's a happy, excited, companion. But you have to consider that, especially as those as they get older, which is on a much more rapid time scale. If they're having orthopedic issues, it's as you're well aware, much more difficult to lift a 150
sure.
pound dog than a 10-pound dog. So usually we try and keep for people who are older looking for a companion in that terriers and Malteses and whatever those kinds of mixes. Chihuahuas sometimes if they're not super aggressive they can be, so that you have to look for those kinds of signs. But those are I definitely recommend avoiding the working breeds because they have a lot of energy, require a lot of work in terms of giving them an outlet for that energy. For example, border collies and Australian shepherds and cattle dogs and German shepherds. There's a reason, I always tell clients when they if I have the opportunity to see them before they pick a
Right,
breed
right.
versus after, which is
Mhm.
always better. But they'll say I always say there's a reason you walk through the airport, you see certain breeds, German shepherds, you see labs, you see beagles. You don't see Chihuahuas and Malteses
Right.
and
Yeah.
Yorkies and Shih Tzus checking bags and working because they're not working breeds. They're much more um, you know Cavaliers, King Charles Spaniels. They're just much more docile and easier to maintain and easier to deal with. So that's what we look for.
So, having said that, how do you evaluate the level of aggression of a dog if you're going to place a 5 or 6 year old dog with someone? I hear that standard poodles are great support dogs,
Yeah,
for
I mean,
example, that how do you is there a way to determine,
I
if
mean,
the dog might be on the aggressive side?
no question. It doesn't always manifest, which makes it more difficult. But there are some tricks and techniques. A lot of trainers, for example, will have people hold a dog, especially a young dog, on their back and just like lay them in your lap on their back. If a dog will just lay there or will let you or eventually will give in, it's a more of a sign of a dog that's not going to be as temperamental, aggressive, or dominant versus a dog who just flips out or can't handle it or starts vocalizing. um Basic restraint when you hold them, if they are very mouthy and very you know uncomfortable with being restrained, that certainly is a sign of potential aggression and should be a flag to say, well, we need to look at it or evaluate it and work on it. I mean, many of these things can be worked on, but again, it's work and it requires a lot of physical restraint, a lot of physical manipulation. So, most of them, if you can get them to lay fairly still or respond or not move as much or be reactive as much, that's usually a sign that there's not an aggression issue.
It's stunning to me when you see maybe a large dog, even like a Pyrenees or a Saint or any of that, will
Right.
go over and just lick a baby's face,
Oh
and
yeah.
then and then you'll see a Chihuahua going ballistic.
Yeah.
It's stunning to me to how we see
Yeah.
all that
Or
different.
or even more so when you see a Chihuahua and when my dog goes up to a small dog, uh, she's the one running away, and
Yeah,
she,
yeah,
I mean, fit the dog in her mouth if she
right,
wanted to. But
right.
it's the size. There's a lot more behind it than size that they see. In other words, they rely to each other on facial expressions. You'll see many Chihuahuas will literally stare down a dog 20 times its size, and the other dog if they're smart enough to understand that means I should probably back off if this is going to not end well versus
Right.
the one that just goes, okay, I'll just go for it and tries to lick. And
Yeah.
but yeah, I mean, I think like you say, there's a lot of misconception about what's appropriate for having a child in the family or having an infant, but poodles, I mean, labs, as you're aware, pretty low key and easy when it comes to infants and babies and things like that. They're totally comfortable with it. Whereas some of the other breeds, you know, just depends on, and again, I think it's an issue of size and breed and working or not working and how much training they've had, etc.
What is it about labs that seems to be the favored dog for seeing eye support dogs, especially if somebody is infirmed in their home? I've seen so much evidence
Right.
of the lab being the number one dog for that.
So it's a good question. I like to think of it as, and there's this kind of misconception a lot of people have. They have a lab at home and they're, oh, my dog is the smartest dog.
Yes,
He'll sit in his cage and not have an accident for 48 hours if he's accidentally not let out to
right,
go,
right.
or we'll sit by the food bowl and wait. And to me, it's a subtle balance between smart and responsive, not too smart and not too responsive, so to speak.
Got it.
Whereas to me, um, like as an example, like I find German Shepherds an incredibly smart dog and very motivated and are used often for other tasks. For you see them in finding people and for weapons and drugs and all that stuff because they're very easily imprinted and they're so um they get so anxious when they're looking for something because they're just been that's what a shepherd dog does is look for the sheep or the wolf and make sure the sheep are protected. Um but what comes with that when they're very smart is it's a lot harder to get them to calm down or to get them to not be as focused or to relax or to respond in that environment. So I think there's that perfect balance between what we associate as smart versus responsive or trainable or something in between. So you don't want something that's too smart who's going to look at you when you say, if you sit there for 4 hours and wait while this light is changing, or while you need to do whatever for the person, you'll get a reward, and they'll actually sit there versus wait 20 seconds and just go, oh, like many of the other breeds do. So there's that. They have that balance, I guess, that
That's very
they're
interesting.
just
Yeah, I wanted to talk to you about also the imprint on the dog. I was doing some research before the show about this, about is there a universal age of the puppy in which you leave it with the mother before you take it away from the pack?
It's a good question. I mean, universal. I mean, I'm not sure. I've seen dogs that are weaned at like a couple of weeks and they end up fine. But
Okay.
it's too early is definitely not ideal. I mean, it's probably closer to 8 to 8 weeks, something. A little bit. 8 to 12 weeks, I would say, is probably better once so at least they have their independence, but they're still reliant a little bit. I have seen issues with dogs that are taken away too early because
Mhm.
they haven't really had a chance to develop some of that social and interaction. And also, most the mothers are very often part of that early training process because they will guide them in the right direction and let them know if they're being overly aggressive or overly inappropriate, things like that. So it definitely helps settle it. But it's difficult to say exactly when, but somewhere in that range is what I would imagine.
Do they experience, because I know with every dog well, when I got the second Saint, he just jumped in with the other two. He just acclimated beautifully. We took him very late though. I don't know if you remember, we
Yeah.
moved my mother-in-law in, who was in her 90s, on a walker, and my friend said, "You're gonna bring a Saint Bernard into the house?"
You're
But
crazy.
I said, "Well, let's do it all at once, like but he acclimated very well. But I know that when we brought Gracie home, the lab we have now, she cried. I was told she was about 8 weeks, and she cried her eyes out every night. And so that's, I guess, what I'm looking for is that if you're pulling the animal away, the dog away at a certain age, older is better.
A
And
little older is definitely
yeah,
better. Yeah, I
yeah,
think so for sure. Unless again, it's the kind of thing where the earlier it's not a problem. It's just going to be more work. That's all. Like you say, they're going to need that replacement for whatever they were getting from their maternal influence at the time. So, once you take that away, there has to be some replacement. So it's not the kind of thing where if you're the kind of person that's at work all day and you just leave them in a crate all day and whatever and come home, later is better for that situation because you're skipping that step, so to speak.
Dogs in packs. Like I know people like to get, well, I only want one dog. It's already too much work. I can tell you from experience, I've had one, two, and three at the same time, and I found it was the same thing. And I also found having multiple dogs in the house, they really did take care of each other. I swear by that. Um, is it better to take two dogs at one time? For the
It
dog's sake, I'm thinking of the emotional health of the dog.
Yeah, I mean
Yeah.
again, there it's hard to make it universal because I've seen
Mhm.
situations of both. I mean,
Yeah.
there are some, again, breeds and just individuals, just like for the rest of
Like
us and in
people.
our own
Mhm.
families and in people, etc. There are some individual dogs that just are great in a group situation, and there are others where they're like, whoa, and kind of stay to themselves or become more aggressive. Most of the time, it is true. They develop a family unit, a pack, a group environment, and adapt to it fairly well. And like you say, even help each other. I mean, they will interact in ways that they wouldn't without that influence. So I think it's definitely most of the time it's beneficial to the individuals themselves to be in a group situation.
Now, we are all so conscious of how we eat, how we live, and it's carrying over to our dogs. I just had a couple of just thoughts I want to throw out to you about pet wellness. Is it really in line with what they need to have soft beds, security blankets, boots on their paws, vitamins, highly specialized food formulas? I believe in, of course, the appointments and the teeth cleaning and all that, but we're turning. My husband always says you I forget the word. You know what I mean? We're turning the dog into a
Right,
person. So
right.
is that bad, good, doesn't matter? Is that
I mean, obviously there are limits to all of it, but I think it is definitely a good thing. I mean, there is no question that we are seeing uh, pets live significantly longer than what we used to see, and certainly even before my time. I mean, the days of they're old, whatever it
yeah,
is,
yeah,
that's what it
yeah,
is. It's certainly a thing of the past, and I always say, I mean, I say it for myself and I say it for my patients as well. Age is not a disease.
right.
The concept of, well, it's just old age. I've seen 18-year-old dogs that shockingly are okay. I mean, they're old, but they're shockingly okay. So there's a lot of disease processes, as you well know, that come with the aging process. But the better the tools we have to detect them, the better the tools we have to treat them. As long as they're not suffering or in pain or in discomfort, there's no reason why those things shouldn't be added benefits. I mean, again, there is a extreme level where sometimes, do I think you have to spend more on the food you're giving to your dog than you would to your own family? I don't know that that's the case, but there are general philosophies. Like people will ask me, how do you treat your dog? And I say, I mean, you ask me how I treat myself and my family. Sometimes we eat junk. I mean, there's
Yeah,
no question. Is that great? No. Do I know it's bad? And I try to be healthy, but so, when my dog wants a treat and it's not the greatest, okay, it is what it is. But there's no question that we've extended the longevity significantly, and that's a good thing. I mean, it's yeah, as you know, it's very hard when you have big dogs and it's a shorter lifespan. It's traumatic, and
very traumatic.
whatever we can do to extend it is great.
So we all need to, I keep saying I'm so tired of telling people to, drink water, exercise, and eat their vegetables. Okay, so we need to do that with the animals. We all need to engage in daily movement, healthy eating, and dogs seem to really need help with this. I mean, how much fitness do dogs actually need? And I also want to add on with cats. We had cats as children. They just seem to figure it out and roam around. And cats are an interesting breed to me in that I feel like you don't have to tell that their instinct to live seems to be more innate than any other animal I've been around. They don't really like people. I
So,
mean,
so
they do, but but dogs really, Gracie will stand at the door, wag her tail, bang on the front door. When I go outside, she's eating the leash for me to put it on. She really has it down. We have a multi-walk routine every day. Um, can they, if you have a big house and a giant backyard, can you just leave the dog to its own devices?
Yeah, I mean, there is no question that exercise and diet and nutrition and all of the same things are incredibly important. And I mean, we see a tremendous amount of obesity in dogs, the same as in people, especially. And I mean, here I know for a fact that we see that, and it's kind of almost ironic because it's one thing that we have absolute total control over. For ourselves, it's a lot more difficult to motivate yourself to go to the gym or to go work out or to not eat the chips that are in front of you or whatever it is. Whereas, you know, I can literally calculate the calories to the absolute single calorie that I'm providing them and the amount of exercise. If I put a leash on and I force them to go, they will go.
Right.
So we do have control, and it definitely makes a difference. I mean, we see different things. We don't see heart disease in the same manifestation as we do in people. We don't see like heart attacks and atherosclerosis and arterial sclerosis and all that stuff as much, but we see lots of other metabolic conditions and other kidney disease and things like that, that diet and exercise play a huge role in. So yeah, I mean, I think it's beneficial. It depends in terms of like whether the yard is enough or walking them is enough. It kind of depends how their weight is. It depends on their metabolism, how much they eat, and what they do at home. I mean, many dogs, if you have access to a yard, but you just lay there and look at it, it doesn't
Right.
really
Right.
matter that much.
Yeah.
I mean, I will be honest, my own personal dog, um, I don't walk that much because I mean, she's not it's not that she's not trained, she just is so strong and eager to go that no matter what I do, she pulls so hard and it's exhausting for me, but I will try on occasion. But she will go out to my yard and when it hits her, she will literally run circles and circles for about 20 minutes until she just, is like collapses. So she's able to sell and her weight is maintained completely.
Mm-hmm.
She's on the
Mm-hmm.
thinner side, so she's fine. And she's not a huge eater, so it works out fine. But um, for many other dogs that are overweight and just sit there, they need to be forced to go out for a walk, and the exercise has to be put on them.
So when it comes to walking, do you recommend the neck leash over the harness, or again, is that breed specific?
It depends on the how strong they are. I mean,
Yeah.
a harness would be a joke with my dog. I will tell you.
Okay.
Like, I mean, unless it was made of like I don't know, aluminum or steel
Yeah.
or
Yeah.
something.
Yeah.
No, I mean, it depends. But most bigger dog. I mean, I'm a fan of what we use here are I mean, we don't use choke chains or anything like
Right.
that. It's just the loop, simple loop leashes. That's basically a rope with a loop at the end of it because I'm not the ones that clip onto something. I've seen so many collars tear or the
Oh,
clasp
okay.
falls and then
Okay.
they get away.
Yeah.
And it depends on the
Yeah.
dog. If
Yeah.
they're the
Yeah.
kind that will stop and come back, great. If they'll just keep running to Santa
Yeah.
Monica, then
Yeah. Yeah.
then it's not ideal. But the simple loop that just gives good control, it loosens as they loosen. And there is a misconception that it's, oh my God, it's
You're
cruel, it's
choking it, or
painful.
it's
You're
right.
not
Hmm.
really. The goal
Hmm.
is when the pressure gets a little bit much, most dogs, again, most will slow down and allow it to loosen a little bit. So the goal is not to choke them. The goal is for them to stop. So, but that's what we use here, and they work pretty well.
Yeah, it's and everybody gets into their own groove with their dog, about what time they go and how
Oh
long
yeah.
they go, and the dog gets very used to it. On a not so nice note, it's perfectly acceptable for us to euthanize our dogs when it's time. And we'd never do that to a person. And we've all been there. Unfortunately, that's the reality.
Right.
One thing about the lifespan of a dog, I think it helps children, particularly, understand lifespan and
Yep.
understand death and dying and so forth. But veterinary medicine has now reached a point like you said, you can extend the dog's life a little longer. Um, what are the signs to you when it's time to put the dog down? What is it? How do you determine when there's no hope? I
It's
guess
it's
that's,
a very subjective assessment, and I try and because obviously clients will come to me asking for my guidance. I need you to tell me when it's time. I get that almost daily. I'm relying on you to tell me when it's time, and I admit that I'm more than willing to help and guide them, but I rely on the client because they have the relationship with the patient and they can see there's again, it's like we talked about in the beginning, there's visible clues and visible facial expressions and when you look and you can just feel that they're not happy or they're not comfortable or their quality of life is diminished. um, those are the things we look for. I mean, it's like we say, I think euthanasia for us is a gift that we have to give to our suffering patients to not have to put them through that. And obviously, for people, that's a whole other
oh,
discussion
oh,
of
sure.
of,
Yeah.
of well, and I mean, I wouldn't even go there. But the fact that we have that ability and it's acceptable, I think, is a great thing. Um, I do think that it's a responsibility that has to be taken seriously. So, a lot of the time, for example, with bigger dogs, it's an issue of mobility, it's an issue of comfort, it's an issue of, when they just can't get up anymore, despite trying everything, physical therapy, medications, acupuncture, laser, all the different, modalities we have for orthopedic issues. But a larger breed dog at 15 or 16 or somewhere around there, most of the time will have arthritis, neuropathies, other things. And if they can't get up at all, then they can't get outside to relieve themselves and they're not comfortable. And, no, and it just becomes an unfortunate situation. The other things we look for are, loss of vision, loss of hearing, loss of appetite. There's a lot of things where if they're not doing anything and I mean if they're not in pain and they're just sleeping a lot, which most older dogs will do anyway, that's not necessarily an indication. But if they
Right.
seem like they're just unhappy or they're just when it becomes so difficult to manage them, they most of them will understand that, and actually they feel worse. A dog who's been well trained and a great companion for 13 years and then at 14, 15 knows that you're upset because they're going to the bathroom everywhere and can't get up and just cry all night and don't sleep and wander through the house and fall down the stairs or fall into the pool or all those things. That's the point in a relationship where they know it's not the best such situation, it isn't, and it's a mutual decision. And I'm always willing to jump in at that point. It's not the kind of thing I don't want my dog anymore. That's
Yeah.
not appropriate in that
Yeah.
regard.
We had our childhood Saint Bernard. We had her until she was 13. She had a little German Shepherd in her, a little something in her.
Right.
And when my mother took her, I'll never forget it. She was 13 and it was Thanksgiving and she just couldn't. My father had to carry her outside to go to the bathroom. And
Yeah.
New York winters, that's not.
That's not ideal.
And when we got to the doctor, he said he scolded my mother for letting her live that long. That it
Right.
had been, that her bursitis was so bad or arthritis was bad, she couldn't hold herself up anymore. So yeah, and I like to carry that over, with people, with humans, is we really have to be accepting of old age, and we
Yep.
can learn that from a pet. This has been so informative, Dr. Schlanger. What tips and advice do you have? Just quick takeaways for us in the care of an aging dog.
I mean, I think it comes down to what we discussed in the beginning about recognizing, even though they're not able to tell us how they're feeling or to tell us that they're tired and to tell us that they're just done or whatever it is, that we have to rely on a lot of other uh, cues that are out there that to see what's going on. And I don't think I think that age in and of itself is not a disease, and I
Mhm.
think it's okay for them to be older, and I think it's okay to do as much treatment as is within your budget and is
Okay.
within you're willing to do, and to keep them comfortable. But the things we look for is just a quality of life, and there is no completely objective, universal assessment that says here is what quality of life is for all of your pets. It's subjective. It depends on the individual. It depends on what they're used to, and it depends on your situation, how big they are, etc. But when the quality is accepted by the people in the household and by the doctor who's treating them, as is when we feel that quality is diminished, I think that's an acceptable, time. And but like the rest of us who are working far older and
Yeah.
living longer,
Yeah.
hopefully,
Yeah.
there's certainly, it's a good thing that we can have so many treatment modalities available, and that we're seeing dogs. I mean, like I said, I've seen 22-year-old cats for sure,
Oh,
plenty of
wow.
times, and I've seen dogs that are, 18, around that age, and are okay. You know what I mean? They're not necessarily incredibly healthy, but are doing okay and doing their basic function, and then everyone's happy, and that's the goal, is quality of life.
Managing. It's great. Dr. Kevin Schlanger, veterinarian and owner of Brent Air Animal Hospital, thank you so much for joining me here. This has been so informative. And of course, in closing, I want to ask you what you like about getting older.
I'd like to say wisdom, but it's still a process. It is not easy, any of it. I mean, it
Yeah.
is just difficult. My back certainly doesn't love it like it used to, but yeah, I mean, there is definitely, an advantage of the wisdom we have at a certain point versus looking back on some of the decisions that are made earlier in life that are a benefit of aging.
Absolutely. And for more information about Dr. Schlanger and its National Pet Dental Health
Yeah,
Month,
exactly. Yep.
you can reach him at brentAirAnimalHospital.com, one word,
Yep.
in Culver City, California. I can't recommend this practice enough. Like I said, I've all my dogs have been there and came out smiling for sure. And I want to thank all of you for listening to It's Okay to Be Old. Please subscribe to my channel here. And for more information, topic, request, and feedback, you can reach me at www.patriciagreenberg.com. Thank you again, Dr. Schlanger, and I look forward to more conversation.
Absolutely. My pleasure.
Okay.
Anytime.